Hey, it's Dr. Lakeisha Watson, epidemiologist and data storyteller, translating data into public health insights for Black women. Welcome back to Epi Fridays. All right, y'all, we are kicking off Black History Month with a mini series called Black in the Day. And the goal of the series is simple: to look at moments in Black history that are often treated as past, even though their effects are still showing up in our health right now. So today we're starting with slavery, and I want to be very clear before we go any further. Slavery was real, it existed, and it was violent and harmful. And the fact that I even have to say that is problematic in itself, but here we are. So let me say it again. Slavery was real, it existed, and it was violent and harmful. Not just emotionally, not just socially, but biologically and structurally in ways that we still see today. So let's get into it. When we talk about slavery, I feel like it's always framed as something that ended in 1865, right? But from a public health perspective, slavery was a massive population-level health exposure that lasted for centuries. Enslaved Africans were forced to live under conditions that we know harm health: chronic undernutrition, extreme physical labor, overcrowded and unsanitary living conditions, physical and sexual violence, family separation, and constant psychological terror. That combination matters because these weren't isolated hardships. These were layered, continuous, and intergenerational. So I've mentioned cumulative exposure a few times on Epi Fridays, right? The idea that repeated stressors stack over time and across life stages, producing wear and tear on the body. Slavery was a massive cumulative exposure, and it didn't just affect individuals, it shaped entire populations. Plantations function like environments of concentrated risk, right? So food allocation, housing quality, reproduction were all controlled, and not to preserve health, but to maximize labor. That logic matters because it teaches us something about how Black bodies were positioned within early American systems as expendable, extractable, and manageable. Now, fast forward, researchers have examined whether the legacy of slavery is still visible in health outcomes today, and the answer is yes. One line of research compares U.S. counties that had very high concentrations of enslaved people before the Civil War to counties that did not. And what they found is that places with higher historical levels of slavery tended to have larger racial gaps in life expectancy today, particularly for Black Americans. That means where slavery was most entrenched, Black people today are more likely to die earlier, even after accounting for factors like income, education, and healthcare access. That's literally history embedded in place. Other studies have looked specifically at heart disease mortality in the South and found that counties with higher historical concentrations of slavery experience slower declines in heart disease deaths among Black populations over the last several decades. So while overall heart disease mortality has gone down nationally, Black communities in these areas have not benefited at the same rate. That lets us know that the environment shaped by slavery didn't just disappear, right? They evolved into modern systems that still shape stress, resources, and risk. And this isn't only about geography, right? So slavery also shaped how Black bodies were treated by medical systems from the very beginning of American medicine. Enslaved people were routinely denied care or used for medical experimentation without consent. And those practices helped build medical knowledge while simultaneously teaching institutions that Black pain could be ignored or minimized. And that history matters when we look at disparities in things like maternal mortality, pain management, and chronic disease. So when people ask, why are Black health outcomes worse, or why are they still worse, right? The better question is, why would we expect them not to be, given the conditions this country was built on? So basically, what I'm saying is that history shapes exposure and exposure shapes health. Slavery was bad, it existed, and its effects are embedded into our lives today, not just in memory, but in our bodies and in systems. This Black in the Day series is not about staying in the past, but it is about being honest about how the past still organizes the present. This is just the beginning. We'll be going deeper next week, so I will see y'all then. Bye.